Laser tissue soldering is an alternative to sutures that uses lasers to bond tissues together. It works in both open and minimally invasive surgeries because it only requires thin, flexible optical fibers to deliver the laser light to the wound. This makes it fully compatible with laparoscopy and other minimally invasive techniques. Sutures can be difficult to apply correctly in minimally invasive surgery. In laser tissue soldering, a biological paste called solder paste is placed on the wound and is fused together with the tissue with the use of a laser. This creates a strong, continuous bond without the need to pierce the tissue and risking causing tears and infections, especially in soft tissues. With a few modifications, this technology can also be used in resource-limited settings, like low and middle-income countries. The setup is simple to assemble, with the instrument easily mounting onto surgical robots using just a few screws. The optical fibers also connect seamlessly to the optical components. To ensure sterility, the tool, the only part that touches the patient, is designed for easy removal, reuse and sterilization. All materials and components were carefully chosen to be compatible with autoclaving, the most widely available sterilization method in low and middle-income countries. Using a robot makes the soldering process semi-automatic, reducing dependence on the surgeon's skill and making the technology more accessible where training and experience may be limited. Light-based distance measurements ensure precise fiber placement and a constant distance to the tissue, reducing the risk of errors. Finally, we designed the system to be energy efficient, using commercially available, cost-effective components. The robot, laser and computer can all run on a single petrol power generator, allowing the technology to function reliably even in areas with unstable electricity.